Ozempic, Semaglutide, and Wegovy, Semaglutide, can look like the same drug. Same weekly shot, same headlines, but the rules are not the same. Ozempic is used in diabetes care, while Wegovy is mainly used in weight management. Wegovy has an approved use to lower serious heart problems in adults with known heart disease and obesity or overweight. Same ingredient does not mean same treatment plan. That confusion matters because people often borrow the wrong story. Someone hears an Ozempic diabetes story and applies it to Wegovy. Someone hears a Wegovy weight loss story and applies it to Ozempic. The same ingredient can affect blood sugar, appetite, and how fast the stomach empties, but the treatment goal changes the rulebook. The simple split is this. Ozempic is mainly used when type 2 diabetes is one of the conditions being treated. Wegovy is mainly used when weight management is the main treatment goal. That split changes the goal, the dose path, the follow-up visit, and the questions your clinician asks. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. The active ingredient copies a gut hormone signal. A hormone is a chemical message your body uses to control organs. This signal helps release insulin when blood sugar rises. Insulin moves sugar from the blood into cells. The same signal can also lower appetite and slow how fast your stomach empties. That is why one ingredient can have two different labels. In diabetes care, the central target is blood sugar. In weight management, the main target is losing enough weight to improve health and keep it off. Those goals can overlap, but the patient and clinician are not measuring success the same way. A common mistake is treating the names like simple substitutes. A doctor should not only ask whether this drug family could work. The better question is, what medical problem needs treatment? That question decides which label makes sense. Ozempic can be used for adults with type 2 diabetes. The visit may focus on blood sugar readings, A1C, kidney blood and urine tests, other diabetes medicines, and low sugar risk. The term A1C means the average blood sugar level over about 3 months. Wegovy can be used for adults with obesity. It can also be used for some adults who are overweight and have weight-related medical problems. The visit may focus on weight trend, appetite, nutrition, side effects, and whether the dose is tolerable. Tolerable means the body can handle treatment without side effects taking over daily life. Wegovy is also meant to be paired with lower calorie intake and more physical activity. That does not mean the drug is just willpower in a pen. It means the label expects a long-term weight plan. The official drug information also lists extra uses for some patients. Ozempic may also be used to reduce certain heart and kidney risks in adults with type 2 diabetes. Wegovy may also be used to reduce serious heart problems in adults with known heart disease and obesity or overweight. The drug label, not the active ingredient alone, can decide the treatment path. Online comparisons often remove the details that matter. Two people can both say they are taking the same ingredient. One may be treating diabetes, another obesity, and another may already have heart disease with excess weight. The key question is why the drug is being prescribed. A weekly shot using the same active ingredient can lead to different goals, different follow-up visits, different safety checks, and different insurance forms. The medical reason comes before the product comparison. That diagnosis difference changes dosing. Ozempic dosing is built around diabetes care and blood sugar response. Wegovy dosing is built around weight management and long-term use. The dosing plan should follow the medical purpose, not a friend's result. This does not mean Wegovy is simply the strong version. It also does not mean Ozempic is simply the weak version. Strength is the wrong frame. Purpose is the better frame. The right question is not which name sounds stronger. The right question is which treatment plan fits the patient's diagnosis and goal. A diabetes patient may need blood sugar control without low sugar problems. A weight management patient may need appetite control that can last. A heart disease patient may need a discussion about risk reduction, not just pounds lost. After choosing the right purpose, one safety rule should stay plain. Wegovy should not be combined with other products with the same active ingredient. Using Wegovy and Ozempic together is not a shortcut. It means taking the same active ingredient twice. Switching names is different from combining them, but it still needs a plan. A patient should not guess the next dose from a chart or a forum. The clinician needs the product name, current dose strength, last dose date, side effects, and treatment goal. Familiar ingredient does not remove the need for a plan. Keep those product details available. Bring the box, the pen strength, or a clear photo of the prescription label. Your clinician needs the real name and dose. Guessing creates avoidable confusion, especially when two products share the same active ingredient. Once product details are clear, the diagnosis explains what the next visit should monitor. The diagnosis tells the clinician which benefit matters most and which risks deserve closer follow-up. That is why the same ingredient can lead to different questions at the next visit. The same diagnosis that guides follow-up also affects insurance and pharmacy rules. For Ozempic, insurance usually wants diabetes records. For Wegovy, insurance usually wants weight records, weight-related health problems, or heart disease with obesity or overweight. The product name is not just marketing. It can decide whether the prescription is approved. That is why a friend's coverage story can mislead you. Your friend may have a different diagnosis, different health risks, or different insurance requirement. The shared ingredient does not mean insurance will pay for it the same way. Coverage can also change over time, so a plan may approve a medicine one year and reject it the next. Pharmacy shortage rules, employer insurance plans, and prior authorization rules can also change. Prior authorization means the insurer asks for proof before paying for the prescription. That proof should match the diagnosis before treatment starts, not after. Because coverage depends on the diagnosis, prepare 3 practical checks before asking for either name. Confirm whether you have type 2 diabetes. Identify the main goal, blood sugar, weight, heart risk, or a combination. Ask which diagnosis your insurance needs before it pays. Turn those practical checks into facts you can bring to the visit. Bring your diabetes status, current weight and height, and key medical history. Include heart disease, kidney disease, severe stomach problems, and your full medication list. One useful sentence can keep the visit focused. Say, I know the active ingredient may be the same, but I want to know which product fits my diagnosis and goal. Say the product name, the dose, and the main goal in the same conversation. That steers the visit toward diagnosis, safety, and access. Ozempic and Wegovy can share the same active ingredient, but the name still matters. The name points to the diagnosis, the treatment goal, the follow-up plan, and the access rules. That is why the name still changes the plan. Same drug does not mean same plan. If you compare diagnosis, dose goal, monitoring, and access rules, the two names become very different decisions. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.